Well, our friends at the Heritage Foundation have taken a closer look at the monstrosity that is the Pelosi 2,000-page whatever. Here, in part, is what they find. You should listen up because this is going to affect each and every one of you. The individual mandate. In other words, each of us are going to be mandated to do things. Like the earlier version, this bill requires the uninsured to pay an extra income tax, 2.5% of adjusted gross income above the filing threshold, capped at the national average premium. Paying that tax wouldn't buy anything. Those paying this tax would remain uninsured. Does that make sense to you? Those premiums would increase rapidly with income, amounting to an additional tax on those with incomes below 4 times the poverty level, equivalent to $88,000 per year for a family of 4, ranging from 1.5% to 12%. Let's see. This tax on low and moderate income Americans would be in addition to a surtax on higher incomes ranging up to 5.4%. Do you realize everybody's going to be taxed under this bill? Either by being compelled to purchase health care that they don't want, or being taxed for purchasing health care that the government says is a Cadillac system, or just because they earn a certain amount of money. I mean, this is crazy. And how is that going to improve health care to anybody in this country? So people who don't take health insurance are going to pay an extra income tax, approximately 2.5% of adjusted gross income, and it doesn't buy anything. They can still walk around without health insurance. Now, what about the employer? The employer mandate. The bill imposes a new 8% payroll tax on employers who don't cover specified percentages of their employees' health insurance. This is a huge expense. In other words, either you do what we, the government, tell you to do in terms of health care spending for your employees, or we are going to tax you at 8% of payroll, and folks, the employees will still be able to get health care from the government. And if they choose not to, they will be taxed too, as I read this. At least 2.5%. Now, employers would have to get the money to pay the tax from someplace. And much of it would come from cutting wages or other benefits, or cutting payroll for that matter. And this tax also would not go to pay for any coverage. The bill specifically says that the tax paid by the employer shall not be applied against the premium of the employee. Furthermore, since this tax would be lower than the cost of providing health care, especially for low-income workers, this would reduce the incomes. Oh, for God's sakes. Taxes, mandates, that's all I know. And still you're going to have, they say, 5% of the people uninsured. Well, now, what's 5% of 300 million? 15 million. In other words, and I have said before that there are 12 million people without insurance, right? Long term, who really have no way into the system. The rest do. So let's say it's the same number, 12 million, 15 million. In other words, the real uninsured won't be changed one bit. Not at all. Stunning. And we're going to destroy our health care system for that? Furthermore, health plans would have to meet new requirements to be specified later by the new Health Choices Commissioner. And others are. If your employer's health plan doesn't meet those requirements, you couldn't keep it. Employers would have 5 years to bring their plans into compliance. So let us say that your employer has a health care system in place or has purchased one that you like. If it doesn't meet the standards set out by the Health Choices Commissioner, don't you love these names? Like I say, they're the opposite of what's true. The iron-fisted authoritarian is now a Health Choices Commissioner. The employer has 5 years to fix it, or it doesn't apply. The commissioner could require coverage of services people don't want, which increases premiums, and then in the name of cost containment prohibit plans from covering services people do want, but that the commissioner doesn't want. What is this commissioner stuff? Everyone's going to pay more, almost. A new appointed bureaucrat will make your health care choices for you. A commissioner. Ladies and gentlemen. Come on now. Most of you don't like tyranny. Most of you want to make your own choices when it comes to your health care and the health care of your parents and your children and your grandchildren. Can you think of one person that has all the information and knowledge to make decisions for each and every one of us when it comes to the kind of coverage that we want or need? What kind of system is this? What kind of government has this become? And what kind of people accede to this kind of activity? A health choices commissioner. More powerful than the Supreme Court, more powerful than Congress itself, more powerful than the president in terms of your survival when it comes to health care. A health choices commissioner. And, of course, the middle class isn't going to pay taxes. You're going to be taxed up the wazoo if I read this correctly.